6. Behavioral health services. So let's talk about mental illnesses and substance use disorders. So mental illnesses are specific diagnosable disorders characterized by intense alteration in thinking, mood, and/or behavior. Substance use disorders are conditions resulting from the inappropriate use of alcohol and drugs. These behavioral health disorders affect 1 in 5 Americans, and finding affordable services can be a challenge for many. Now let's talk about different health professionals. So psychiatrists are physicians who make a diagnosis, prescribe medications, and may or may not provide psychotherapy. And other health professionals include psychologists, clinical social workers, behavioral disorder counselors, and psychiatric nurses. Primary care providers also screen patients for mental health and substance use disorders, and they prescribe medications. Allied health fields have developed in response to the growing needs of the community and availability of funding. This includes school counselors, special education teachers, and art, music, and recreational therapists. Mental health facilities. So mental health facilities were developed in the 19th century, but they were state hospitals in which instead of treating the patient, it was used to protect the public. The creation of the National Institute of Mental Health, or the NIMH, in 1946 and the development of psychopharmaceuticals in the 1950s were major breakthroughs that led to the real treatment of mental illnesses. And psychotropic drugs allowed thousands of people to return to their communities and be treated on an outpatient basis. In 1963, JFK signed the Community Mental Health Act into law, which led to changes in how mental health services were delivered and provided funds for the establishment of comprehensive community mental health centers, or CMHC, throughout the U.S. Grants were provided to finance staffing and conversion, and centers provided inpatient, outpatient, and daycare as well as emergency services, and these were required to provide specialized services for the mental health of children and the elderly. They also offered special preventive and rehabilitation programs for behavioral health disorders. Treatment of patients. So discharging people from the hospital was an acceptable approach for treating mental illnesses, and patients who had been living in institutions could be treated in community facilities if a comprehensive program was available. But the government failed to adequately fund CMHC needed for addressing the needs of those diagnosed with serious mental illnesses, or SMI, which include schizophrenia and severe bipolar disorder. In 2017, 11 million adults in the U.S. suffered from SMI, but nearly half of those needing treatment were not getting it because they could not afford the cost of treatment, they didn't know where to go for treatment, or they thought they could handle the problem on their own. Now let's talk about the opioid crisis. So drug addiction became a crisis in 2001, and in 2014, nearly 2 million people in the USA suffered from substance use disorders, and this was an addiction to prescription opioids and heroin. The USA addressed the opioid crisis by increasing patient access to medication-assisted treatment, such as methadone treatment and naloxone, and behavioral health treatment programs. And naloxone was made available to emergency room staff to prevent death. The Protecting Access to Medicare Act of 2014 funded the Certified Community Behavioral Health Clinics, or the CCBHC, to expand access to comprehensive mental health and substance use disorder services. Behavioral health care. Because mental illness and substance use disorders are now the leading causes of disability and death, hospitals also work with healthcare workers in primary care settings to create assessment and treatment for behavioral health disorders. But 1 in 8 emergency department visits include a behavioral health condition, usually suicide ideation, and it occurs where access to behavioral health care is limited. Mental health insurance. Most private health insurance policies limit the number of days in the hospital and the number of outpatient visits for treating mental illness and substance use disorders. Since 2008, services began to be covered by health insurance policies as a result of the Mental Health Priority and Addiction Equity Act of 2008. And the ACA also requires that all health insurance policies include mental and behavioral health services. But those with serious mental illnesses often are unable to seek treatment because of disabling effects of mental illnesses. And disparities in behavioral health care access for various populations will continue to result in poorer health outcomes and increased costs across the healthcare system. I know that was a lot, so here's a brief summary. 1. Behavioral health services consist of mental illnesses and substance use disorders. 2. Health professionals in this field include psychiatrists and psychologists, but also allied health professionals such as teachers. 3. Mental health facilities were developed in the 19th century, but instead of treating the patient, it was used to protect the public. The creation of the National Institute of Mental Health led to the real treatment of patients with mental illnesses. 4. The Community Mental Health Act, signed in 1963 by JFK, led to the establishment of comprehensive community mental health centers throughout the USA. But the government did not fund the community mental health centers, which led to the development of serious mental illnesses such as schizophrenia and severe bipolar disorder. 5. The opioid crisis led from 2001 to 2014. The USA tried to solve this by increasing patient access to medication and treatment programs. And the Protecting Access to Medicare Act of 2014 funded certified community behavioral health clinics to expand access to comprehensive mental health and substance use disorder services. But mental illness and substance use disorders are leading causes of disability and death in the United States. And finally, since 2008, services began to be covered by health insurance policies as a result of the Mental Health Parity and Addiction Equity Act of 2008 and the Affordable Care Act.